So, allergic bronchopulmonary aspergillosis. This is a topic that is a bit confusing to me because the question kind of seems vague. And when you're doing a bunch of pulmonary disorders, you're not sure, is this asthma? Is this cystic fibrosis? Or is it any other immune deficiency disorder? Because it's not exactly very specific. But one thing that has helped me when I was going through questions for this specific topic is it occurs in patients who already have asthma or cystic fibrosis. So it is an exaggerated IgG response to Aspergillus in pre-existing people with asthma and cystic fibrosis. So it's an hypersensitivity reaction. So it often occurs in these immune compromised patients, and the x-ray is going to show you bronchiectasis, or it's going to show you, it's called a fleeting infiltrate. So fleeting infiltrates, you're going to see them in one part of the lung and then they disappear, and you might see them in a different part of the lung. So they're kind of like transient infiltrates in different parts of the lungs. And so how do you go about noticing? So they present with typically fever, pleuritic chest pain, dyspnea. They have productive cough, hemoptysis. And when you see a lab workup specifically, you just have to know in general, okay, it's elevated IgE. You don't need to remember the exact numbers, although it says in these, in the information, it can be above 400 approximately. So IgE is elevated, IgG is elevated, and eosinophils are elevated, like more than 500. That's just to remember, that's very exaggerated. And all these symptoms typically last for a while, I mean, more than 3 months. And sometimes on the x-ray, you also find a fungus ball, which is the aspergilloma. So the treatment for this that is recommended is you're going to give a oral prednisone, so a steroid. And for recurrent episodes, you're going to use an azole, an antifungal. Once again, I might be pronouncing these wrong, but you know what I'm talking about. So it's itraconazole or voriconazole to be specific. These are the two main specific ones that they use. So you're going to use a systemic steroid, oral prednisone, and then either an antifungal itraconazole or voriconazole. So this is enough to, if you keep looking at these specifics that I just told you, that's enough to usually recognize it for exam purposes. Okay?